But we are coming to our last station now, colon cancer screening. So everybody knows about screening colonoscopies. It's not one of those obscure things. But let's look at some facts. This is the second leading cause of cancer-related death. And 600,000 people, that's a typo there, it's worldwide, die from colorectal cancer every year. What is your lifetime risk of getting colon cancer? It's about 5%. And 90% of these colorectal cancers seem to happen after the age of 50, and that is why the task force and the ACG and the AGA have come up with the recommendation that 50 is the age that you need your first screening colonoscopy. Now, the interesting fact is, as common as redundant as you have heard the word colonoscopy, only 65% of eligible adults who need to go through colon cancer screening actually are going through colon cancer screening in this country. Some of the facts to understand and to tell your friends who do not believe in getting themselves screened is one of the prevailing, beyond the embarrassment of going through the whole procedure, one of the things you hear is like, well, what is meant to happen has happened. Who can prevent a death from a cancer? Now we have the evidence that colon cancer screening on a 30-year follow-up has actually proven to not only remove colon polyps, but to actually reduce mortality related to colon cancer deaths. So in this country, we're actually on a decline in deaths related to colon cancer. And even if someone has a one-time screening, a half evaluation, which is a flexible sigmoidoscopy, there seems to be a 23% decrease in the incidence of colorectal cancer. So why die of embarrassment? This is something that everybody should undergo, and they should definitely recommend their friends, and people have reservations about going through with the process to have it removed. This is a cartoon that is showing the progression from a tiny little polyp that is found on the surface of the mucosa, which slowly starts infiltrating into the deeper muscle layers to now involve the lymph nodes and the surrounding blood vessels. And once that happens, it's only a matter of time. It's carried to this distant organ. But this process doesn't happen very fast. It takes its time, and usually it starts in the size of this little polyp, which can easily be plucked off, while if it's allowed to grow over time, it can become a complete cancer. So why not make use of the window of opportunity to knock it off when it's this small? So there are several tests. If you look at the task forces, they recommend a FlegSig every 5 years, which is looking at the left half of your colon. My concerns with this is it does not look at the right side of the colon, and they're particularly in women, the incidence of right-sided colon cancer is definitely higher. So as most gastroenterologists, I would also recommend colonoscopy as the first option of choice, because not only you get to see these polyps, you also knock them off at the same time. There are other modalities that you could go through, which is the air contrast barium enema or the CT colonography, which is recommended every 5 years if your insurance approves of it, and you could talk to Tina more about it. But again, you got to remember that if it is positive for a polyp, you would have to go through a colonoscopy anyway to have it removed. There are other upcoming tests looking for evidence of cancer, not polyps. That would be like the DNA testing. And those who are gun-shy still of colonoscopy, fecal occult blood testing is also something that is recommended by the task force. And this also reduces the incidence of colon cancer, only because if once someone is positive, maybe then you get a chance to oblige them to go through the more gold standard test, which would be the colonoscopy, to have the proper evaluation to see if you just have a polyp or you actually have a cancer, which is still in the treatable stage. So wrapping up with a cartoon over here, just looking at the gender spread in this population, you can say it's the women who are typically taking the proactive role in pushing both themselves and the family towards preventive health care. So here's a lady said, since you've only got a few more days for your healthcare benefits for this year, I'm going to call and see if I can get you in for a colonoscopy. And that is a typical male response. So I'm going to see if I can cut off the phone line.